Hello, Joan.
Hello, Sasha.
Thank you very much for coming to Moscow and for giving a lecture and workshop that we will have this weekend. And right now I want you to ask a few questions, so for specialists, and maybe you can tell us a little bit about Schema-Therapy. So my first question is, what is Schema-Therapy and how it is different from other methods?
Okay. Well, Schema-Therapy is an integrative treatment that combines the cognitive, experiential, and behavioral pattern-breaking interventions with a theoretical model, an etiological model that's based in the research of developmental psychology. So I think a difference is that it includes developmental psychology. Mm-hmm. So there's an adequate model of a person's development, and it also includes addressing the emotional level of experience, which is so often where the cognitive and behavioral approaches get stuck. Mm-hmm. So that a patient may say, I know in my head I'm not bad, but I feel bad, like I'm a bad person. And I know early in my career, when I started practicing, that was a dilemma. I thought, I don't have anything I can use for that. So that's how it's different, is that it does include kind of the best of all worlds in terms of intervention.
So would it be fair to say that Schema-Therapy not only works with cognition and behavior, but also with emotions?
Yes.
Yeah. Wonderful. If there is any evidence that Schema-Therapy is effective, I know that's a relatively new method, so can we rely on some research?
Well, actually the studies began in around 2000, and there are 6 treatment studies of group Schema-Therapy, 3 additional ones of individual Schema-Therapy for borderline personality disorder, a major trial that's completed for avoidant personality disorder, and then there's a lot of research going on around the world testing the effectiveness of Schema-Therapy for various disorders, because we have models in Schema-Therapy of the different disorders, but of course we have to test the effectiveness empirically to be able to be evidence-based.
So we know that Schema-Therapy is effective for borderline personality disorders, but now we try to understand how effective it is in other disorders.
Right, although we could say too that it's effective for cluster C.
For cluster C. Wonderful. My question is, what do you think? Can Schema-Therapy be used as a first-line treatment, or it is still kind of the method for those who didn't respond to the other, maybe less involved treatment?
As a clinical psychologist, I can't imagine using anything else. So for me, it's the first choice of treatment. And again, it's very individualized. So I would only pull from the different groups of interventions the ones that I needed for that particular client in terms of where their difficulty was. It's the idea of looking at the problem the way the client states it, and then looking at the different modes of the different schema modes and how are they involved, or are they involved in the problem. The thing is, almost always they are involved in some way. And so it's almost like working at the core and making an adjustment that then has benefits and ramifications throughout the person and throughout their functioning.
Okay, thank you. Can Schema-Therapy be used for treating axis 2 disorders?
Axis 2 or axis 1?
Axis 1 disorder, sorry.
Well, it was originally developed for depression. So, and again, so frequently in the Axis 1 disorders, there's some Axis 2 involvement. There's some personality disorder features. It's not uncommon, say in 60% of the people with an Axis 1 disorder. So I think if it was a limited anxiety disorder, you might want instead to go to CBT. But with depression, so often that again goes back to the level of emotion and the fact that the person's life isn't very fulfilling, not just because of the depressive symptoms, but because of earlier lack of having childhood needs met.
Okay, thank you. Nowadays, we experience cottages for finances and medical care, for psychological help all over the world. And the very important question, can Schema-Therapy be brief?
That's a question that I'm part of looking at that more, because it is a reality of mental health. When we first started the study that we're conducting in group Schema-Therapy plus individual, and I'm co-PI on that with Arno Arntz, when we were first looking at it, he was insisting on 3 years of treatment. I was saying it'll never get funded in the US. We had trouble getting 8 months of treatment funded, but there was the luxury in the Netherlands and some parts of Europe of giving as much treatment as patients wanted. Well, over the 10 years of the study, that's changed drastically. So our first randomized controlled trial of group was only 30 sessions. People are testing 20-session group protocols in Australia, where they're limited to 20 sessions a year with their government's policy. And we're getting good results. So I think my personal belief, not completely tested yet, is that you can do at least as much with Schema-Therapy in a limited number of sessions as you can with any other approach.
So we will look forward to see the results, because that is very important. So Schema-Therapy addresses a very difficult group of patients. So some argue to say that it's the most difficult group of patients. What is the requirement for professionals who study and practice Schema-Therapy? So should they be more qualified, or maybe have certain specific personality qualities that is necessary for practicing Schema-Therapy?
Very interesting question. In terms of qualifications, the International Society of Schema-Therapy requires that people have a graduate degree, at least a master's degree, and that they be licensed as psychotherapists in their country, if their country has licensing, and that they have a few years of practice before beginning training. So those are the society's requirements for certification. I think that in terms of personality characteristics, warmth is very important. The ability to be genuine and human with all of our, flaws and strengths. I think that you have the ability to be compassionate. And something Jeff Young says is the ability to see, say, borderline patients as needy, but not greedy. So it really is a compassionate view of these patients. And to be able to see the little child in them that didn't have his or her needs met, and now their behavior could be quite obnoxious for an adult, but you see the origin of it and have some understanding of that, and then help them do better to get their needs met more effectively. So,
well, almost like you have to have a big, kind, healthy adult yourself.
Exactly.
Yeah.
That's a good way to put it. And some happy child.
And some happy child. Fair enough, fair enough. I think my last question, because we covered mostly everything I have on my list. So you and I brought Schema-Therapy in Russia. And I know that you've done a huge amount of work that contribute to development of this, this approach in this country. And I know that you started more than 6-7 years ago, so it's a long,
That's true,
it's
yeah.
a long time.
Actually, I think 2010.
So 8 years. So how do you see the future of Schema-Therapy in Russia?
Very interesting question. Something that I'm very pleased about is that more and more Russians get the importance of including the emotional level of experience and can be very warm and accepting and also have a happy child. What I've seen that was very interesting to me is that sometimes people start off in Schema-Therapy training and they're rather proper and taking notes and no smile. And by the end they're kind of much happier, much more expressive. So I think that the training in Schema-Therapy is healthy for therapists too. Because the idea that being yourself is an advantage is a very growth-producing sort of idea for therapists. So I think it's quite compatible with Russian therapists, and I'm happy to see it growing more and more. For example, now a second institute here in Moscow under your leadership.
Yes, thank you very much, Joan. And another thing that 3 years or 4 years ago, it was only few members of Russian Schema-Therapists in ISST conference, and I think the last year it was around 25. So
At least.
yeah, so we're definitely growing, and this a lot of because of your and others' effort, and we really appreciate your help and support, and we're very happy and proud that we can now continue, and proud that you were our trainers, teachers, supervisors, and thank you so much.
Thank you very much. You
work.
were a wonderful student and are a wonderful trainer, I'm sure.
Thank you. Okay, thank you very much.